had a great time all year long talking about all these different lung diseases, and I'm really excited actually for this topic, so I feel like it's not one that we talk about quite as often. We talk a lot about lung cancer, we talk a lot about COPD. Pulmonary hypertension is extremely common and something that a lot of people have a lot of questions about and don't quite understand what's going on. So I am here, I'm Janelle Hahn, the Executive Director for your local American Lung Association. I'm really excited to be here with Dr. James Tarver of the AdventHealth Cardiovascular Institute. Thank you so much for being here.
Thank you for having me.
We are staying masked, and COVID is definitely still a very real thing, so we're close together, we're both vaccinated, just to make sure that we're all on camera together too. But let's get down to it. So let's start out with the basics.
Sure.
What is pulmonary hypertension?
I think one thing that's important to understand when we're talking about pulmonary hypertension is to realize that the lung has a unique and distinct set of blood vessels that's kind of separate from the blood vessels we typically think about when we're talking about cardiovascular system. So these blood vessels in the lungs are separate from the blood vessels that we assess when we put a needle into your arm or take a blood pressure in your arm. Pulmonary hypertension is an elevation in the blood vessels that are in the lungs. And so we talk about that, but it's very difficult to diagnose because it's not that accessible. It's not related to the blood pressure that we take in the lungs, in the arms, and it's not a set of blood vessels that we have ready access to. So that makes it a challenge to make this diagnosis.
Sounds like it definitely is a challenge, and I'm sure a lot of people out there are wondering, so what causes this?
So that really depends. One of the other really important things to remember is that there are actually multiple different types of pulmonary hypertension. So it's sort of several diseases within a disease. So the causes of each type of pulmonary hypertension are different. So in type 1 pulmonary hypertension, for example, we think that there may be a genetic cause. For some cases, it's sometimes associated with congenital heart disease, can be associated with certain connective tissue diseases like scleroderma or lupus, for example. We also see this in some forms of advanced liver disease, in HIV infection. You can also see type 2 pulmonary hypertension in people with heart valve disease or weakness or stiffness of the left side of the heart. You can see this in type 3 disease with people who have lung fibrosis or who have advanced emphysema or COPD. In type 4 disease, you can actually see this from people who have long-term complications from blood clots in the lungs or pulmonary emboli. So there are a wide variety of different potential causes, and with each of those causes, the diagnostic evaluation and the treatments are different.
That's so interesting, and it's, I think, such an eye-opener for people to hear how there are a lot of diseases that you mentioned that aren't what we consider a lung disease.
That's correct.
And it's all so intertwined with each other. So that's really, really interesting. At least for me, I learned something new today.
And that's why it's so important for us to have good relationships and good communication with specialists in all different fields, because there are so many different specialty diseases that actually are linked to pulmonary hypertension.
So fascinating. So what are the signs and symptoms that somebody should look for or be aware of when it comes to pulmonary hypertension?
One of the things that makes pulmonary hypertension so difficult to diagnose is that the symptoms are very nonspecific. So primarily the symptom is shortness of breath, but of course we know that shortness of breath can be caused by so many different things. So people often are diagnosed with other more common diseases that are more likely to be associated with shortness of breath. So very often we see that people will go anywhere from 1 to 2 years from the onset of symptoms before this diagnosis is made. So my thought on that is common things are common, but those common things should respond to common therapies. So if we're thinking someone short of breath has asthma, yet they're not responding to common asthma medications, we should think that there's something else going on. If we're thinking that someone is maybe deconditioned, well, then an exercise program should actually make that better. So when people don't respond in the way that you expect, we have to think out of the box, and pulmonary hypertension should really rise to the top there.
Very interesting. So somebody is found to be diagnosed with pulmonary hypertension. So what's next? How do we treat this and help them to try and live a normal, healthy life?
The most important thing first is to have a good evidence-based workup. And so when I say that, there are guidelines that are out from the American College of Cardiology, from the American Heart Association, from the European Respiratory Society, that go through the appropriate evaluation when pulmonary hypertension is expected or suspected. And so those things really need to be done, because establishing a good diagnosis and then determining which of the 5 different types of pulmonary hypertension is present is absolutely essential before any therapy is started. And one of the main points of this is, while an echocardiogram is a great way to help suspect the diagnosis, and while an echocardiogram can give you a window into the pressures of those blood vessels in the lung, you cannot actually make and confirm the diagnosis with that. And a right heart catheterization is absolutely essential before any therapy is initiated, because that helps us distinguish between the different types of pulmonary hypertension. Now, the good news is that if you had asked me 20 years ago or more what the options were for therapy, we wouldn't have much in the way of answers. But the good news is that since 1995, when the first pulmonary hypertension therapy was approved, we've now had an explosion of treatment options for the right types of pulmonary hypertension. And so we actually now have many options. And the key is first having an accurate diagnosis, and then the second is having the therapies that are appropriate applied in the correct way. And one of the ways to really ensure that that workup and that therapy is appropriate is to seek out an accredited pulmonary hypertension center. And I think that's an important thing. The Pulmonary Hypertension Association actually has accredited somewhere between 60 and 70 centers across the country as centers of excellence. And those are centers where you can actually ensure that that evidence-based workup is being done and that all different types of therapies are available.
That's really interesting. And one thing that you had said that really stuck out to me was 1995. That's really not that long ago. Yeah. And that's incredible to see how far things have come in such a, in my opinion, short period of time.
It's really an amazing time in medicine, because there are so many dedicated people looking at some of these rare diseases, and the technology has advanced to the point that we can really do good, detailed, and revolutionary studies with that. One of the other advantages of having an accredited center is that all of these centers have active research programs. So while we have FDA-approved medications, those are a good answer, but they're not the full answer. And so bringing new therapies to market is really important for this. And ultimately, we want to have enough research so that we can find a cure for this disease.
That's fantastic. And this has been really educational for me, hopefully for folks that are tuning in on the American Lung Association Facebook page. Anything that you would like to add that we haven't talked about when it comes to the spectrum of finding out you have pulmonary hypertension to treatment?
Yeah, I would say if we were talking to someone who suspects that they may have pulmonary hypertension, I think one of the most important things is be your own advocate. This is a rare disease, and because of that, physicians don't necessarily have that much exposure to it. And because of that, we sometimes overlook those things. And I would say, again, if you're not responding to standard therapy, certainly ask the question, what else could this be? And why do I have this? And certainly seek out people who are experts in this disease process if you are diagnosed with that. And the wonderful thing is, here in Florida, we've got several, now 4 accredited pulmonary hypertension centers. Not enough for the entire state, but certainly this is something that's bringing the expertise out to more people and making that more available. And I think that's important. But definitely be your own advocate and seek out additional answers.
That is all fantastic advice. So for our listeners, if they are interested in contacting you, Dr. Tarver, how can they find you?
So we can be found through the AdventHealth Cardiovascular Institute website, and there's a link to our practice on that page as well, and we actually have a dedicated intake coordinator for new patients who are looking, who can help shepherd you through the process of getting an appointment.
Fantastic. And for also additional free resources, you are always welcome to turn to the American Lung Association. We have our lung helpline at 1-800-LUNG-USA, as well as on our website at lung.org, where you can chat live with a representative for free information. So again, thank you so much, Dr. Tarver, for your expertise today. We'll get that link posted with the video that'll be up on YouTube after this, so that people can continue to find you. And thank you again.
Thank you very much for having me. I appreciate it.
Thank you.